People, it seems, have moved on. Life is bustling again, leaving behind the scars of the pandemic. Markets, schools, and colleges, trains, metros, and buses are bursting at the seams, announcing that India is about to become the world's most populous country. Some recent events, like the ongoing IPL matches and the opening of Apple stores, also suggest that even the latest surge in COVID cases has not hit the lives of most people. India reported almost 74,000 fresh COVID cases in the 7-day period ending April 22nd. This was a 20% jump from the almost 62,000 cases reported in the preceding period. In fact, the latest week's case count was reportedly the highest recorded in India in the 8 months since the middle of August last year. The country's weekly cases have remained above the 50,000 mark since April 14th. The good news is that the recent surge witnessed in COVID cases has started showing signs of peaking. The 7-day test positivity rate, or TPR, has seen a drop for the first time in close to 2 months. On April 22nd, the 7-day TPR stood at 5.41%, down from 5.58% a day before. According to one report, data from Delhi, Haryana, and Tamil Nadu also showed that the surge was, at the very least, close to peaking. On April 23rd, the daily COVID cases dropped to 7,178 from 10,112 the previous day. Nonetheless, the recent surge in cases has shown some characteristics of a wave.
When we talk of a wave, we are talking about rising numbers. But if it is only the number of diagnosed persons with infection that we are counting, then certainly there is a wave in terms of that rise. But if we are really looking at a wave in terms of serious illness landing people in hospital or intensive care, then there is no such real wave.
So, how will the latest wave play out, and are more surges likely?
Every pandemic, every epidemic of a new variant, a same pattern will come, start, peak, go down. There is no guarantee it will peak all over India simultaneously. You will see in each geographic area, there will be a clean peak and clean fall. We have had several, not one or two, several surges, several peaks. Okay? Some documented, some not very well documented, they're gone.
And till Sunday, COVID cases were still rising in several parts of India. Apart from the eastern states of West Bengal, Bihar, and Odisha, the surge in cases reportedly continued in Rajasthan, Chhattisgarh, and Punjab. However, the silver lining is that despite the rise in cases, in absolute terms, Eastern India has not recorded a high number of infections yet. So, even though the recent surge is showing signs of peaking, there may still be some steam left in it. Against this backdrop, how should India respond to not only the latest COVID wave, but also similar surges in the future?
Travel restrictions are unnecessary unless the number of serious cases are rising. A watch should be kept upon what type of variant is bringing people into hospital and intensive care, and try and do genomic analysis so that to find out whether new variants are emerging which are likely to turn more problematic. Similarly, at the community level, you can do wastewater surveillance in order to find out whether there are large number of cases likely to arise because the numbers of viruses in the excreta in the wastewater are also rising sharply, and particularly if there are any new variants that are coming in.
We have to be, as a healthcare system, has to be very vigilant, because what we have been blessed with, an Omicron virus, which does not have the capacity to cause the same kind of pneumonia as its predecessors. Only problem with this particular virus is that they keep changing the shape so often, and every new one is an immune mutant. We are able to overcome our immunity. It will cause surges, but there's nothing you can do about it because none of the vaccines work.
Part of the reason that stringent measures have not been called for this time is because how the latest wave has been different from previous ones.
The population is not immunologically naive. It has some immunity conferred by vaccines, some immunity conferred by prior exposure to the earlier forms of the virus. And therefore, with all of that, it's able to also resist the infection when it happens in the human body. And at the same time, our health systems are much better prepared for a response. So in all ways, this particular wave, as we are calling it, is likely to be far less lethal and dangerous than what happened with Delta.
Ultimately, this means that India should not shrug off the latest COVID wave or threats posed by future variants, which need to be tracked diligently. However, the stringent measures of the initial waves are no longer necessary, as long as future variants remain relatively mild.
If you like this video, share it and subscribe to Business Standard. For more news, views and insights, log on to www.business-standard.com. Do also follow us on YouTube, Twitter, Facebook, Instagram, Telegram and LinkedIn.